As a doctor registered with the GMC, you should provide a good level of care to your patients. It's your responsibility to be aware of the GMC's Doctor's Rulebook. Good medical practice is essential reading for every doctor, and awareness of good medical practice is vital to your chances of success at interview. It'll give you the answer to every ethical question that they throw at you. The duties of a doctor are a series of 14 statements set around 7 broad values. Ultimately, you should recognize that you are personally accountable for your practice and that you must always be prepared to justify your decisions and actions. As we go through the statements, think about difficult scenarios that you may have encountered or that they may throw at you. How would you respond? How could you demonstrate that you take responsibility for your actions? Do you admit it when you've made a mistake, or do you try to hide it? Do you offer an apology? You don't have to admit guilt to say that you're sorry that a patient's been upset or felt ignored or has had to wait a long time. Come up with a few phrases which sound genuine coming out of your mouth and clearly get across your personal accountability. Some examples might be, being the doctor on duty, I would have to, it is my responsibility to, I would feel compelled to. Play around with some phrases that you might use to bring out your justification for any of your decisions or actions. Some examples are, I would do this so that, in order to, so that, with the aim of. Patients are always your first concern. If you're faced with any type of ethical problem dealing with a patient, the spinal reflex is to come out with a phrase such as, my first duty is to my patient. I would first see to the needs of my patients. Obviously, the patient's safety would be my prime concern. You can never be criticized for dealing with your patients first. However, you should also follow that up with some practical suggestions detailing what you would do to ensure that patients are looked after properly. This is where the vast majority of your competitors will fall down. Medical students have often learned to rattle off the phrase, I would assess and stabilize the airway, breathing and circulation. When I follow up with the question, well, in which ways would you assess the airway? They appear flummoxed. Think creatively about what practical things you would do if you were faced with a situation given to exercise your duty of care to your patient. So, for a drunk doctor, exercising your duty of care might involve removing the doctor from the clinical area, providing or arranging cover for that doctor's clinical duties for that day, reviewing every clinical decision or action made by that doctor that day, and, if necessary, offering the patient a brief explanation and an honest apology. For a situation in which you had a disagreement with a nurse over the treatment of a patient, your first duty of care would be to your patient. To exercise that, you would ensure that the patient was clinically stable enough for a discussion to take place. If a time-critical decision had to be made, then, as the senior clinician on duty, you would execute your decision in good faith, being fully prepared to justify your actions. You have a duty to promote health as well as treat sickness. Be aware of health promotion messages such as stopping smoking, safe sex, sensible drinking, vaccination, healthy diet, exercise, breastfeeding and depression awareness. Ensure that you'll be able to speak for 20 or 30 seconds on any health promotion advice that you'd be expected to deliver in the post that you're applying for. This will certainly provide icing on the cake type answers, but it might even provide the basis of your answer if asked, how would you deal with a parent who didn't want their child vaccinated? What would you say to a lady who wanted gastric banding? Should we offer angioplasty to smokers? Honesty, openness and integrity should be values that you fall back on when faced with a dilemma. These are useful words to describe yourself or your actions. Think through a few phrases for yourself, such as, I would do what I felt to be right. The honest thing to do is, my policy is to be straightforward and honest. If faced with a situation where a patient is being put at